Welcome everyone. Today I'm here to discuss the topic of LASIK surgery. Are you tired and frustrated with contact lenses and spectacles being your only form of visual correction? Then this is the channel for you. I'm here today with Dr. Maleka, who's an ophthalmologist in Sandton and specifically does a lot of LASIK procedures. Later on we'll join him and he'll run through the processes with us. Thank you, Dr. Maleka, for your time in just taking us through the journey with LASIK. As a qualified optometrist, you know that we work together all the time in referral of patients to you, and I just would like some insight from your side. We have those patients that have exhausted all their options on contact lenses and spectacles and they just need a change. So would you like to brief us on what exactly do you need to conform to the criteria to be able to do LASIK procedure or any other surgery?
Okay, you need two things. You need a refractive error that can be corrected with glasses or contact lenses. If you have a refractive error big enough to require contact lenses or glasses, then laser can correct it. And number two, you need a healthy eye for us to do laser on your eye. But any refractive error can be corrected with these modern lasers.
So there's no minimum power or anything like that?
There is no minimum power, but the maximum power applies around -8 for short-sighted individuals to -10. That's the gray zone. We don't normally treat anybody above -10. Okay. And for long-sightedness, hypermetropia, the limit is around 3 to 5, +3 to +5. We normally do not treat above that. And when it comes to astigmatism, we treat up to -6 of astigmatism, but most patients, as you know, are around -1 to -3. But astigmatism can be treated as well.
If a patient complies to all the criteria, they have the healthy eyes, their prescription is within those limits, will the LASIK procedure leave them free of spectacles forever, or how long could they expect to be free of specs?
The answer to that is yes and no.
Yes.
The patients being treated and they're under the age of 45 will be spectacle free. They'll be able to drive, watch TV, yes, work on their desktop computer, including looking at their cell phone or reading material without glasses. But above the age of 45, normally 48 or so, presbyopia sets in, where even people that never used to wear glasses all their life, around 45, 48, they start pushing back their reading material. Those patients above the age of 48 will require reading glasses following laser, unless we tweak the laser a little bit, then we do monovision for them, where one eye is for reading and one eye is set for distance. But with the two eyes open, the brain thinks you're reading with two eyes when you're actually reading with one. Okay. And when you're looking at distance, the brain thinks you're looking at distance with two eyes when you're looking with one. So there's a bit of a give and take. It's not a win-win situation after the age of, let's say, 48.
Okay, and obviously the patients have to go through quite a complex process of measurements and tests for you to determine their ability to have a procedure.
Most definitely, and the most important test is to exclude keratoconus, and number two, to look at the corneal thickness. Yes. The laser thins your eyes, it thins your cornea. Following the laser procedure, your corneal thickness will be lower than before the procedure. So we need to make sure that you have enough tissue for us to do the treatment, dependent on your script, obviously.
And so if you've been a contact lens wearer your entire life, you still are able to do a laser procedure, provided you've looked after your eyes well through the years, you basically say.
That's very true, and it's actually one of the most commonest indications for laser, especially for women around the age of 35 to just about 40. Yes. That's when they become intolerant to their contact lenses, and they come in seeking a solution, a permanent solution, because they wouldn't want to be caught dead
yes,
wearing that
exactly.
glasses.
Everything is about cosmesis these days, Doctor.
Yes.
And in terms of medical aids and costs, and is this a procedure that one could claim for medical aid, or is it still considered cosmetic and it's something you need to fund on your own?
Unfortunately, it's considered cosmetic. There's a few medical aids, normally the smaller ones, that sometimes pay for laser, but the vast majority of the bigger medical aids, no, it's not paid for.
Okay, so the patient can definitely come and see you in your beautiful rooms here in Sandton, and you can do a consult and take them through the processes.
Most definitely.
Which other conditions can be operated? You've discussed short-sightedness, hypermetropia, which is when people can't see far. And what is this big word, astigmatism?
Astigmatism is when you have two focal points in the eye for your image. So when we look at an eye, we do measurements in the vertical meridian. So looking from top to down, we take the power of the eye, and we also take the power of the eye looking at it horizontally. And if the horizontal power of the eye is different to the vertical power of the eye, you're going to get two images, two areas of focus at the back of your eye on the retina. And that difference is called astigmatism. So what happens is one of the images will be blurred if just one power is corrected, and we need to correct in two meridians for the image to be crisp and clear. So the laser can correct the power in both meridians, both vertical and horizontal, for one to be able to form a clear image on the retina.
That's amazing. Most of the patients I see have the perception that if you have astigmatism, there's nothing you can do, no one can help you. And as most people in lay terms, they refer to it as the rugby ball shaped eye as opposed to the soccer ball eye.
Yes, so that's very correct.
Okay.
With the football, with the soccer ball, it's a perfect sphere, and the power is similar in both meridians when you look at a football. But when you look at the rugby ball, it's squashed more, meaning there's more power in one meridian as compared to the other one, to give you that rugby ball appearance.
Okay,
that's what they mean. Yes.
Okay. Thank you very much, Dr. Maleka, for your time and for your wonderful explanation, helping people to understand what the procedure LASIK, which is refractive surgery where one is able to correct their visual problems with this equipment, which we call a laser machine or a LASIK machine. I know that you have got a few different techniques and machines that you do use, but we will run through the next one with you over here. So join us again next time on the next episode, where we will be filming a real live LASIK surgery and take you through the whole journey with the patient.